Welcome to Beyond the Books, a podcast that brings to you stories, insights, and voices from the heart of medical world beyond the boundaries of our medical textbook. I'm your host Divya, and today we'll be diving deep into one of the most crucial topics affecting young people worldwide: mental health. Mental health challenges among young people has reached unprecedented levels, from social media influence to academic pressure, from family expectations to uncertain future. Young people today are navigating through psychological hurdles unlike any before. Today, I'm honored to have our guest Sagun Ballav Pant, a pioneering psychiatrist into understanding and blooming beautiful mind. Dr. Sagun here holds an MBBS and MD in psychiatry and is a member of Nepal Medical Association and Psychiatry Association of Nepal. He also serves as an assistant professor in the Institute of Medicine, Tribhuvan University. He also holds a PhD in addiction medicine from University of Oslo. His academic and clinical work majorly focuses on evidence-based approaches to mental health as well as addiction medicine, making him a key voice in the evolving mental health portrait of Nepal. Dr. Pant, thank you for joining us today. And before we start the podcast, I would like to wish you a very happy Guru Purnima. Dr. Sagun, let's start with the basics. For our younger listeners who might not be familiar, could you please explain what psychiatry is and how does it differ from other forms of mental health?
Psychiatry is a medical discipline that deals with diagnosis and management of mental illnesses. This is a special faculty of medicine which is included in neuroscience, mostly dealing with all forms of mental disorders, depression, anxiety, other disciplines in mental health, most importantly clinical psychology, which is based on psychology as well. It deals mostly with brain and behavior. Clinical psychologists will also have responsibility for diagnosing and managing mental disorders, but it differs in the approach and treatment. Clinical psychologists will provide treatment mostly from psychological intervention and they usually prescribe guides, which is other than that, we have other disciplines like disciplines that focus on counseling, which can be specific to various disorders. And then we also have short courses who focus on one discipline, counseling in HIV, counseling for counseling stress management. This is the main strategy.
We would like to know when we talk about mental health, especially among young people. What are some misconceptions that you come across in your practice? Misconceptions regarding mental issues.
Biggest misconception is young people do not have as much stress as adults. We have to understand that when a young person, what would be defined young person, let's say from the age of 9 to 19 or 96, maybe up to 24. Extended analysis. So if you look into this developmental period, you have your body that's changing, you have a mind that's changing, situation is changing, challenges are changing. It's actually not the most easiest phases. So during these phases, we come across a lot of young people just need issues, just need to academia, just need to changing rules in the family. Some of them are college life, so many colleges are not so navigating the advanced like this is a challenge for them. While over time you have problems like developing problems like depression, anxiety, obsessive problems, disorder, sometimes the consistency. What is most important is our mental health perspective. More than 80% of any form of mental disorders as is some form of starting at the age of 20. So in that regard, we see this as a very important process.
Now let's talk about your journey in psychiatry. What made you pursue this degree? What really inspired you, like that one domino that bells, and then it makes you really inspired about getting into this field and passionately talking about people's mental health? What was that inspiration?
So nowadays it's more about the ranking in your medical exams, but I was always interested. I can say that because I started my residency in a month's time after my university. I don't have a lot of experience with it. And I did that because this was a discipline that was core when we started 15 years back. We were not as many mental professionals and understanding mental issues and a lot of stigma and prejudice. But from what I saw in my MBBS days in my medical college, people with mental disorders have their own challenges, have their own health needs, and somebody has to take good care of. One particular case in the psych ward, actually, that I was engaged, that I was doing my internship, really encouraged me to study because I was a good student in school. Professors in surgery and medicine were not very happy with studying as a psychiatrist. I was explaining that discipline, but I was particular. This was the discipline. Some real hard work.
Could you tell us about, in your experience, how has the field of psychiatry evolved over the years, particularly in terms of understanding the younger people's mental health?
So, over the last century, I would say, psychiatry is one discipline that has evolved so much. So, in the early days, maybe not more than 70 years back, or maybe 80 years back, people with mental disorders, especially those with psychotic disorders, were kept away from their kept into mental asylums. They were institutionalized, right? And to have mental illness was seen as a taboo, because of which people that are actually showing signs of psychotic illnesses, most importantly, were taken out from their houses, kept in separate institutions. There was no evidence-based treatment at that time, and all forms of interventions, torture, punishment were given. So this seclusive approach was not the answer, because then a lot of people suffered when they were into these asylums. Then came an era of psychosurgery, where people with psychotic illnesses were lobotomized. And when they were lobotomized, they lost their personality. They became what we call modern day zombies, people without emotions. In the 1950s, a revolution happened, and then people started to discover that psychiatric illnesses were caused by disorders of the brain, like other disorders of the sciences, and there was a surge of researchers that brought good medications and psychological interventions. Before that, psychological interventions were mostly focused on psychodynamic approach, where people were just focusing on talk therapy, relating all forms of psychiatric disorders with disorders of ego and super-ego or some sexual impressions. But with the development in neuroscience and use of new medications, there was a big surge of people. And with the improvement of patients, medical institutions were slowly out of the picture. A lot of psychiatric patients were dying of treatment. Treatment shifted to hospitals and homes. And now, our understanding is a lot of mental disorders can actually be treated at home. There are only a handful of conditions where you want admissions, that too short. So this change from institutionalizing and keeping someone away from the family because of mental disorders to a current stage where people can open up saying, okay, I have depression, I have anxiety, and start continuing their work and living their life, raise their family, go about their business. It's the biggest transition. Especially in regards to youth. In the early days, it was believed that young people usually don't have as much psychiatric disorders as youths, which were challenged by evidence, saying that it is when you are young that you start to show some signs of mental disorders, especially with those with genetic probability, which start early on. And over time, our society has transcended to phases where young people have their own challenges in the forms of migration, lack of supervision from parents, social media observed over the last couple of decades, which is adding on these issues of abuse neglect, bullying, and all these newer issues that we talk about. So now people are understanding it better and supporting young people.
Young people specifically, what are the most prevalent mental health issues that you see among people?
So in our hospital and also in the community sometimes, I think most prevalent problems now are just issues, especially when we talk about young people. They are like spending time at home or at school. So a lot of issues at home, for example, issues with domestic violence, financial neglect, managing substance use, lack of opportunities at home, poverty. These issues are actually adding up to a lot of mental stress for families, right? And then at school, there are issues of bullying, isolation, unity, which still exist in some schools where students are penalized for academic reasons. And we know we're following medical students huge academic pressure on medical students, especially to get good marks, to crack these entrance exams, which adds on to a lot of stress within their system. And with this society changing, they are mostly indoor gaming and internet-based interventions, which is they're less outside. So less people being outside. Software or team sports or they're mostly in the gadgets. That is actually added to your thoughts. This is actually led to a situation where we see young people coming to clinics with symptoms of anxiety, where they have all kinds of anxiety, phobic anxiety, anxiety. We see young people with sleep depression, suicide has actually surged. And one of the most important things are young people are indulging into psychiatric substances, tobacco, alcohol, cannabis. So these would be. But we talk about young people, we also talk about developmental disorders. So we have children with autism and intellectual disability that are actually transcending young people and they have their own struggles. So these are basically these things.
So that's why you said that academic stress can be a very significant stressor among young people. So how do you support your patients when they come with performance anxiety or like with the very big burden of academics? How do you deal with such patients?
So if we focus on medical students, a medical student has a long journey where there are series and repetitions of exams. So the exams start from your entrance exams, then you have continuous exams, formative, summative, post-interview. For example, if you think about completing your post-MD, and MCH, you have about at least 15 to 17 years of study that is there until you are into that. So there are so many subjects, and the medical field is ever evolving. The examination patterns still are not very competency based, still based on long answer questions, right? The fantasy of having to do everything. For the fantasy class. So medical student either comes to us struggling for not being able to perform. We have good students that are actually doing good, but feel that they're not enough. We have struggling students that are starting to realize that, okay, this is a field that we cannot move effectively because it's all exams and exams, right? And beyond that, the regular exams, assessments, create a sense of fear. We like pass, we like fail, we like next semester, which always creates chaos among medical students. So this is actually led to a system spoiling, and sometimes we have medical students that come in a state of exhaustion, where it's just too much of study, exams. But many universities over time have now shifted the pedagogy from traditional teaching approaches to competency-based approaches, which actually now encourage medical students to have life beyond the books like a podcast. So it talks about skills and attitudes, practices which move beyond understanding and knowing of theory and literature. So this approach of competence-based, where you have a certain needed, must-know, good-to-know kind of competencies, and then students are actually encouraged to know the must-know kind of competencies. Some competencies are important when they have to show and do and demonstrate. This creates a situation where the traditional methods of having to do everything is falling out. So this is created somewhat improving, but still a lot of universities, especially the older ones, are sticking on the traditional pedagogy, which is created.
Also, as you said, the family expectations also maybe play a very important role. So, what advice would you give to the parents who might unknowingly be contributing to change practice?
Yeah, so firstly, again, I tell from a very good students is if you're watching this podcast and you're studying medicine with your parents, I would say proud. Because then this is too much of study that has to come along with time. If you don't enjoy something that's doing, it becomes burdensome over time. So I think parents have to understand that studying medicine should come out of interest and passion, and then it actually has a lot of emotional, active, cognitive investment over time. If they're not supportive of that, just focusing on performance and marks and ranks in the class, that actually adds. And I can tell you this much that over time, from once you finish your MBBS, nobody is going to give you much clarified for independent exam to crack your postgraduate. Then nobody looks into your mark sheets again. You'll have to fight an intrinsic. So this approach of competitiveness, students should be smart enough to realize that how much marks I get is not important, how much knowledge I can get, and how innovative and practical I can be. Parents should also understand. I would urge parents not to force medical students to get good marks, to get the ranks, because then that's the waste of their effort, and it actually adds a lot of pressure to a medical student, which is actually good. Because I come across students that are very good in studies, they're not getting into the ranks. They're passing well, they have a sense of knowledge, they're very good with the patients, they have good clinical skills. And in the long run, these are the students that are actually doing very good government over time. They have developed this empathy-based university. So students should communicate about this to parents. Tell them that marks are not the first passing, but gaining skills and insights, going beyond the books, learning of extracurricular activities. It's also important to have sports, because you cannot just expect them to just read and read and read. That has to be.
Because sometimes when we're reading too much, and when we join the medical school, we tend to lose ourselves, like the things that we passionately used to follow, and then we suddenly there's some connection to it, and probably that leads to the mental health stuff.
I think it's also important. It's up to the medical students to keep moving their passion forward. So if you're very good in painting, right, in school, it's important that you come out as a good painter, not just a good drawing. So don't let your passion. But the problem is we have so much of academic achievements to do. Our priority to our hobbies kind of has lesser space. But if you are smart, if you can navigate well, you can actually keep. We have a lot of good writers, musicians, sports persons that have actually come out of medical school. So that's our focus.
So, can you help us understand what is the difference between when someone is having a difficult day or when someone might be in a mental health crisis and requires professional help in that medical intervention?
So anyone can have a difficulty. Right? You can have it. And that's a normal reaction to an abnormal situation. For example, if have a bad exam. If your supervisor gives you a feedback that's not very good to hear, right? If you have a friend that's angry, if you have a friend's birthday that you cannot, and also the relationship issues that happens in marriage, breakups and situations, right? So it's okay to feel sad. It's okay to have a bad day. But these situations evolve over time. Today you feel very bad. Tomorrow you can feel very bad. So over a few days you can. But sometimes when these things start, it becomes enduring. So like someone has a breakup, just can't get over it the weeks or in months. And then these stressors take the whole energy in your life. They're draining you. You're tired most of the time. You're losing your sleep, losing your appetite, losing your motivation, losing your patience. You start going to the college, you not finish your assignment in time, your exam scores go down, you indulge in all kind of risky behavior like smoking and drinking, right? And all of that affects your socio-occupational function. A socio-occupational function for a medical student would be to go to your college, take your classes, go to the clinics or hospitals to do some bedside teaching that will be provided to them, and they start to use that. So once they start to use that, the burden just increases, the academic load keeps increasing. They reach a phase where they are exhausted, sometimes severely depressed. So they're not happy with this. Start to feel low all the time. They don't want to meet with friends. They don't want to go out. They're locking themselves inside their hostel room. And it's very alarming when we talk about things like I feel so hopeless and helpless and worthless. Sometimes they can even develop thoughts of wanting to end it all. It's not just a career, but wanting to end their life. That is also happening. So whenever a friend of yours, a student of yours, from teachers' perspective, shows signs of distress, change in personality and behavior, unexplained changes in behavior like aggressive behaviors, procrastination, a lot of sadness, it's very obvious, and there is this decline in these activities, not just curricular, extracurricular activities. That would be a sign where this person has to stop and emerge.
And as you were saying, some with the feeling of being saddened so much that leads to a very difficult stage, and some of them are starting to have suicidal thoughts. So, what immediate steps that should be taken when someone is having suicidal thoughts?
This is a very important question. So, even if your friend just expresses that I feel worthless, I sometimes feel that it's better to die. I'm walking in the road and I feel that the car just comes and hits me. I feel like not waking up once I sleep today. These are very important signs. As a friend, you should never dismiss them. So if your friend says this to you, take it very seriously and listen to them. When did this start happening? How often are these thoughts coming in the picture? Has he shared this with anyone else? As these thoughts increase to a point where it's getting more intrusive and more repetitive, and it's also feeling bad. So these are indications that has to be. What a lot of us do wrong is when a friend talks about suicidal thoughts, we dismiss them. I'll give you an example. A friend of yours, very good in studies, comes to you and says, Divya, I feel so bad that I sometimes feel like that. You respond saying, what are you talking about? Have you lost your mind? Why would you do that? You're so good in studies. See, I'm struggling so much, but you're doing so well, and you are here thinking about suicide. What would happen to you? What would happen to your family? And so this judgmental kind of comment discourages this person to come back to you. So this friend will never come back to you and say the same thing again because it's a judgment. So as students, we should learn to be non-judgmental when these kinds of issues are discussed. We should be very confidential. We should not go around the class saying, okay, XYZ is suicidal. Right? Be confidential. support this person, will leave him alone, offer them mental health support. A lot of medical colleges have at least a psychiatric department where they can go and talk and sometimes a school counselor, college counselor, or a senior, or a mentor, or a teacher, anyone. Just make sure that they feel that they're not alone. And if we can support and make sure that they get the support in time, I think we can do mental health.
So like we have to have the person talk it out first,
Yeah.
and then make sure that they will be judged. Because that's really important.
And you should be a very good listener. Yeah. So if your friend is talking about these thoughts, make sure you have enough time. Because they're not going to overcome you. You cannot force them to talk about it. It should come from inside. And they should feel very safe and non-judgmental, not judged from their experience. You can do that. I think they will open up more. And many a times we realize that just talking to a close friend in itself is a very good therapeutic. A lot of them feel better after. So talk. Don't dismiss.
Also, as you believe that medical students are anti-depressive drugs, and sometimes due to the academic burden and those might not get it, instead of going to expert in psychiatry, which is also available in the medical school, they would just go to the shop and then they would, at the pharmacy, they would just get the antidepressants and take it on their own. What advice would you give?
And they will do that. So, not just antidepressants, any form of medications that psychiatrists will prescribe, like it can be sleeping aids or antidepressants or antipsychotics. These have to be supervised. Not everyone that is depressed and anxious needs an antidepressant. Right? A lot of that can be there. So if you think you need one, or if you think you're suffering enough, talk to ask help from a peer and reach to a specialist. You can then the psychiatrist or decide look at it. A lot of our medical students during exams use this final exams, especially summative exams, board exams. It's very important that you don't buy medications in pharmacies. And there's also a regulatory mechanism by which they can not actually they'll have to go to the black market to get the medication. So why do that? Trust your mentors, trust your teachers, reach out. Some of them may actually feel that if I go to my teacher, judge me. He thinks that I'm such a good student. Now I'm out of depression. What do we think? As professionals, we are taught to keep privacy and confidentiality as our professionality. But even then, if you don't want to seek a professional from your organization, at least find someone in the city or other institution. It's very important that these interventions are provided by taking it in the wrong way can actually be very conflicting and can actually aggravate the situation.
Dr. Sagun, thank you for sharing your expertise and insights with us. Now, before we wrap up, is there a final message you would like to share with our listeners?
So, medical education is a long, enduring journey. It's sometimes it makes you feel lonely, sometimes you feel disheartened, sometimes you feel distressed. But the perks of being a medical person always outweighs that when you once finally complete your medical degree. So, sometimes it's okay to not feel okay. There will be bad days, there will be hard days, but seek help. You don't need anyone. Talk to your friend, talk to your teacher, talk to your parent. You don't feel alone because there are a lot of medical students that are in various stages of the journey that actually resonate the same emotions that you have. So seek help, talk to the provider, and most importantly, just remember that you're not just a medical person, you're a human being. So have interests that are beyond the books. So if you are someone that likes reading, read. If you're someone that likes dancing, dance. If you're someone that likes painting, do that. But just don't fall into the trap of reading and getting marks, because as I said, nobody's going to look at your marks when you teach it. So enjoy the process, learn more information, and try to be a good doctor, a good human being. Thank you very much.
To our listeners, remember, seeking help is a sign of strength, not weakness. So if you or someone around you is going through mental health struggles or tendencies of self-harm, please reach out to a mental health expert today. Thank you for joining us on this important conversation about youth and mental health. Until next time, take care of yourself and your loved ones. Thank you.